Welcome, everyone, and thank you for joining us today for this Nursing Week webinar event, Opportunities for Nurses to Reshape Healthcare Delivery in Ontario and Beyond, which will feature a panel discussion on nursing and our healthcare system, the exemplar of initiatives driven by nursing leadership and future opportunities. My name is Sonya Canzian. I'm the Executive Vice President, Clinical Programs, People, and Chief Nursing and Health Professions Officer at Unity Health Toronto, and I'm one of two moderators for today's event. I'd like to start our event today with a land acknowledgement. I am in Toronto, and I acknowledge this land on which I live and work is part of the Dish with One Spoon Covenant territory and is the traditional and ancestral lands of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, the Chippewa, and the Wendat nations. Today, the meeting place of Toronto is still home to many diverse First Nations, Inuit, and Métis people. By acknowledging the land, we acknowledge our responsibilities in sharing this land and to the Indigenous people who have been the traditional caretakers of this land. At this time, I invite you to reflect on your relationship to this land, the Indigenous peoples, and broader understandings of reconciliation as it relates to your role in healthcare and specifically nursing. Thanks, everyone. I will start by wishing everybody a happy Nursing Week. And just a note that this event is being recorded, and we will post online to the TAHSN website on Tuesday, May 14th, the link to this recording. And that link should go into the chat now. You'll see it in a minute. And with that, I'm going to hand it over to my co-moderator, Jane Merkley.
Hello, my name is Jane Merkley, and I'm the Executive Vice President, Chief Operating Officer, and Chief Nurse Executive for Sinai Health, and as Sonya said, the other moderator for today's event. Today's event is a webinar, meaning only the panelists and the moderators can turn on their audio and video. If you want to turn on live captioning, you can do so by clicking the button that says show caption at the bottom of your screen and follow the instructions prompted. A big thank you to all the attendees who provided questions when they registered. They were all reviewed and taken into consideration when we narrowed down our questions for the panelists. And before we kick off the question period with our wonderful panelists, we wanted to just share that unfortunately Judy Linton couldn't join us today. Her perspective will be missed, but we are also thankfully have a wonderful range of expertise with our three panelists who will be introducing momentarily. So we're going to start with the same question for all the panelists. And the question is, nurses are the largest workforce that touch patient care. They are highly trusted and are embedded in all sectors on a 24/7 basis. They are uniquely positioned to drive innovative models of care, attach people to primary care, enable aging at home, avoid hospitalizations, amongst many others. I realize, so to the panelists, I realize you don't have a crystal ball, but we would like to open today's session by asking each of you to speak to, just for a few minutes, what you see as some of the key opportunities for action to support nursing and healthcare in Ontario.
Thanks. So our first respondent for this question is Dr. Karima Velji. Dr. Velji is Chief of Nursing and Professional Practice and Assistant Deputy Minister, Ministry of Health in Ontario. So after a career of over 30 years as a nurse and healthcare leader, Karima joined the Ministry of Health as the first Chief of Nursing and Professional Practice and Assistant Deputy Minister in the Ministry of Health in Ontario. Her division is responsible for strategies to optimize Ontario's health human resources, as well as develop long-range strategies for capacity planning for the healthcare system, including an innovative and futuristic approach to health human resources. She's an experienced healthcare leader who's had several senior positions, including President and Chair of the Board of Directors of the Canadian Nurses Association. Over to you, Karima, for your response.
Thank you so much, everyone, and happy Nursing Week. Also want to acknowledge the Indigenous lands on which we live and breathe, all of us, and the spirit and the actions that we have committed towards truth and reconciliation. So good to be with you all today and my esteemed colleagues. I'm so happy to end nursing week like this. It's great. It's a great question, and I love that question because it is oriented to the positive. It doesn't start with the world is falling, the sky is falling, we are burned, we are dead, let's go home. It starts with the opportunity that is in front of us, which is the growing population in Ontario and the aging population in Ontario, and alongside it, all the health issues that have come into fruition predictably and that have the challenges in front of us. Such an opportunity. When I think of the demographic shift that's happening and the healthcare needs that will be associated with that demographic change, what I see is nurse-sensitive work and actions that have to be undertaken. And it will be up to us how we rise to this opportunity. We have an option to hold on to the past, to be very woeful about our profession, or to say, oh my God, look at this opportunity in front of us. Are we ready to embrace it? And it will require a lot of looking at ourselves in the mirror and determining whether we are ready for that inflection point. It is in front of us. It's what shall I say? It's an opportunity that others are rising to. I can tell you this, paramedics, pharmacists, and it's our opportunity to lose or to hold on to and rise with it. And I hope we do the latter. Honestly, it's a great opportunity to inflect the nursing world to its next potential. We've made such a difference to people's lives, and we have an opportunity to continue to do that. But it'll mean reshaping nursing roles. It will mean determining where we should place our nurses, because as you know, the gap between supply and demand will never be closed. So we'll have this ever opportunity to determine where we put precious resources and to what purpose. And I would really urge that we embrace once again our focus on community, primary health care. That's where the care is affordable. That is the kind of healthcare system we need, a system that's reshaped, and nurses have to play a pivotal role in that system. So choices will have to be made. What tasks will we attach ourselves to? What settings will we attach ourselves to? And what type of practice? Will majority of our practice be determined by orders physicians write for us? Or are we going to use our knowledge, skill, and judgment and rise to our nurse-led potential practice? And I hope it's the latter. I mean, that's the service I'm going to be focused on. And my role at the ministry, I'm going to try and shape us as well as possible for that future opportunity. And I hope we rise together, folks, on that we don't cut each other off at the knees. Often that's what happens in the profession. We are not united in our approach, and we lose those moments and opportunities. I hope we rise together.
So thanks, Karima. Very exciting vision. Our second panelist to answer this question is Silvie Crawford. And Silvie Crawford is the Executive Director and CEO of the College of Nurses of Ontario. She's a career nurse who has held executive leadership roles that have spanned complex multi-site academic health science centers and in the nonprofit sector throughout Ontario, and as an active contributor to many provincial, national, and international initiatives. Silvie has brought strong partnerships that positively impact nursing policy and regulation based on evidence and equity to serve the public interest. She has an undergraduate degree in nursing and a Master of Laws specializing in health law. So over to you, Silvia, for your response.
Thank you very much, Jane, and it's a privilege to be here. Happy Nursing Week. So our role is slightly different in this space, and really as a regulator, really looking how do we support nurses and how do we support the health system through public safety. And so I, really proud to say that, for us, the leadership is through collaboration, and we look at that system-wide collaboration and how we build that nursing capacity to really drive that positive change in the health system, but also in patient care environments. And one of the ways we're doing that, and we're continuing to do it and growing that, is really around workforce planning and sharing our data. We've got a wealth of data on our website But we're always looking to saying, how can we put out there our nursing registration? That's province-wide, our application, employment data, and we collect that and then share that with our system partners. And we do analyze and publish those statistics so that that information is available for all to see and saying, what are the needs within the system. And so we're also looking at, how long it takes to register the applicants. And I think that that's been really helpful. And we know that we made incredible changes in that throughout the pandemic to really ensure that the applicants were in the workforce as quickly as possible while maintaining, our safety measures. And so I'd like to say that, we share that data and look at, how we do things both, within Ontario. So through the health professions database with the Ministry of Health, we do share that understanding provincially, but we also do that nationally through the Canadian Institute of Health Information. And we try to inform an understanding of the health human resources, both for the federal partners as well as our provincial partners. And one of the exciting things that we've actually just started working on is called Nurses in Canada, and Nurses NURSYS. And that is a national, we hope it to be a national database, and it will hold information of where nurses are registered and be able to navigate and potentially, really enhance mobility for those nurses who want to come to Ontario. And it'll be a really wealth of information from a human resources database. And so right now it's the two jurisdictions are Ontario and BC. They're College of Nurses and Midwives. And we started, and now we're launching other early adopters, other jurisdictions, Nova Scotia, New Brunswick. And the goal is to have the entire country on this database. And then I think that that would really help give a really solid understanding of our human resources. It's an incredible milestone that we've actually achieved in launching this, and we actually were grateful to have federal funding to be able to do so. In addition to that, I wanted to say we've got really some collaborative partnerships going on with both our employers and academia, and we meet with them quarterly. I also want to give a shout out to Dr. Velji because we also meet from a provincial perspective, our joint meeting, and that includes our academic partners, our unions are on that, our associations and the ministry. And it's a really valuable time for us to come together and really look at, what are those system needs and how do we support each other? So I'd like to say that, the College of Nurses, has spent really dedicated efforts in building those partnerships, and now really delving into, what are some of those, I'll say, strategies that we could then enable. One of the ones that, I'll speak to is our supervised programs that have helped put nurses experience in the workforce, and then they've been able to really garner both their knowledge and the competencies, and then to be able to be registered. So I'd say we're doing a number of things to help support on the regulator side, and it's more, being around our data, being around providing those effective and efficient processes in which to register applicants, and really ensuring that the data is available for all. So thank you for that question.
Great, thanks, Silvie. Up next is Sandra Carroll. So Sandra joins us today in her role as chair of the Council of Ontario University Programs in Nursing, or CUPN. And she's also professor and vice dean of health sciences and executive director of the School of Nursing at McMaster University. As executive director of McMaster University, Sandra is also the chair of the Nursing Education BSCN Consortium Steering Committee, a member of the Canadian Association of Schools of Nursing, and a director of the Ontario Primary Health Care Nurse Practitioner Program Board, among others. Sandra is an associate scientist with the Population Health Research Institute and has received operating funds from the Canadian Institute of Health Research, the Heart and Stroke Foundation, Kennett Hamilton Health Sciences Foundation, and the Hamilton Community Foundation. So Sandra, over to you for your response, please.
Thank you, and happy Nursing Week. I'll try to make 3 points along with my colleagues about the question posed. And first, as the trusted profession and also the largest professional workforce The opportunities for action to support nursing within our academic institutions and healthcare are like no other time in our history. And in partnership with our ministry leaders, Ontario universities delivering nursing education have, as you've all heard, expanded seats for new learners in undergraduate nursing programs and also in our nurse practitioner programs. And these expansions created new opportunities for BSCN programs, new ones, implementation of flexible delivery, refreshed curriculum that supports learners at different career stages, and innovative clinical placements, which in turn drive models of care by placing our learners where there is a need, leading to future capacity if they create relationships in those placement settings when they experience a positive clinical placement experience. Our actions to support quality education in the nursing workforce will continue, and now with expanded scope for registered nurses and additional NP seats, opportunities for postgraduate education will grow. We are working together to deliver interprofessional care with physicians, physiotherapists, occupational therapists, pharmacists, social workers, and more across communities. And we prepare our graduates for healthcare opportunities across care trajectories. Positions must be funded in these settings and available for our graduates. We know that technologies such as simulation in our laboratory settings can be expanded alongside the necessary direct care clinical placements. And at this time, again, in our history, we can work together to tailor unique educational opportunities within our communities which suit the current needs. And these needs are very different in urban versus rural settings. There is no one size fits all. So nursing leaders must continue to take action at decision-making tables to advocate for our profession, but more to be part of the decision. The public trust must be protected with quality nursing education. And second, like our clinical partners across Ontario, schools of nursing are seeing expert faculty transitioning to the final years of their careers. And this is not a surprise. The patterns of academia are like our practice settings. And as such, opportunities to develop junior faculty are key and to support their retention and attract new faculty. And we are creating educational opportunities that support nurses in practice who wish to pursue graduate education. And research and scholarship must remain a priority. And now with recent expanded federal support to enhance funding for master's and PhD, there are opportunities to recruit and retain our master's and PhD students with funding that will allow them to complete their education with a reduced need to supplement their income. Nurse researchers create quality evidence to inform policy and our care delivery, and we must continue to prioritize this. And last, we need to consider the new nursing graduates in today's world. Their career goals are not the same as the nursing graduate 25 years ago or more. Today's graduates will move positions more frequently, make different, perhaps non-traditional career choices now available to licensed health professionals. They will hold more than one position at a time, and importantly, make their wellness and well-being a priority. And we know nurses will leave the profession if they are not satisfied. And as such, with the new retention initiatives and tools that are fully developed for us, such as a retention toolkit, CASN residency programs, new graduates negotiating employment positions should ask for access to these. And with all the tools, if utilized, can increase retention. So I'll stop with that because there's so much we can do.
Great. Well, thank you, Sandra, and thank you, Karima and Silvie, for your responses as well. So the next question is actually, I'm going to ask Karima, this one's for you. So we were all very pleased to see the release of the Nursing Retention Toolkit earlier this year. And we know that this is intended to be action to improve the working lives of nurses in Canada. Interested to know, Karima, from your unique nursing leadership perspective, what aspects of the toolkit do you think contain the greatest opportunity?
First and foremost, really to commend Lee Chapman as our federal CNO to find her value add in the various initiatives going on for nursing recruitment, retention, capacity building. She picked up a very perfect area of focus, which is nursing retention, and to do this federal work really commend her. I like the toolkit. As you know, most of it is a summary of the evidence that we've known through the Magnet Hospital research. We've known it for years, but it now is summarized in one area, and some best practices we've shined a light on some very promising practices across our country, but also across the globe. So I like that. There are 2 or 3 things that really speak to me, and one thing that's not there that really matters to retention, which I'll comment on as well. So anything that's in the toolkit that says flexibility, the workforce, to Sandra's point, has changed. It is changing. It changed significantly in all sectors through the pandemic. So if we don't wake up to that reality, we will be using old approaches to try and retain the workforce, and they will not serve us well because it's not a monolithic workforce. Every cohort or individual in the workforce needs a very unique approach. So if we take on the approach of every premature loss of a nurse in the system is a zero event, like we do for quality improvement, how would we exercise our interventions towards that goal? We would have to understand that new nurses are looking for very different things than our more experienced nurses. New nurses, it's mentoring. So anything that says, mentorship opportunities have to be available at the bedside, at the care side for the new nurses entering the system, that's a crucial retention intervention that has to be considered very strongly. And you'll see a lot of our ministry programs dedicated towards that. Mentoring opportunity, our clinical scholars program is an example of that. The new grad guarantee is an example of that. And then towards the more late career expert nurses, it's almost a one very individualized approach that says, what would it take if Karima is ready to retire in a year? What would it take for us to keep Karima in the system for 2 more years, 1 more year? It's that kind of a very individual approach. These broad brushes we apply to everyone, and we think if we fit them in our box of strategies, it will work. It's not. It's a very individualized approach to every individual. So our HHR partners have to become more sophisticated and nuanced in their approach, basically, to retention. The broad-based strategies don't work anymore. Flexible scheduling, if we are not doing it, any nurse I speak to tells me, I would stay here a year more, or I would stick to this place of work if my schedule I had some control over it. If I had some control over it, and please don't reassign me willy-nilly to every place. Like we did during the pandemic. We had no option during the pandemic, but let's stop that practice now already. And nurses are terrified. When you take an obstetric nurse and float them, to med-surg, I'm going to be terrified and I leave and I'll call in sick. So I think we have to be just aware of turn the page from the pandemic, folks. Turn the page. We cannot be operating the system in the same way that we were doing during the pandemic. Let's stabilize some of our approaches. And lastly, I would say the stuff that's not mentioned in the toolkit, but it's essential to retention in any sector in this economy is compensation. So competitive compensation, and here I will really acknowledge the work of our unions. Our governments may not take a proactive position towards compensation, and particularly government of certain kinds, but our unions have done a fabulous job drawing attention to competitive compensation frameworks and requirements to keep, not only attract the right people into the workforce, but to keep the nurses who are already working. It matters in this economy. It matters because the world is people's oyster. They will venture to the place that will help them put food on their table for their families. So we have to pay attention to that. The toolkit it's quiet on that front. But I think it's okay for women and for nurses to say compensation matters. I say that. When I'm giving advice, I don't shy away from that point. But kudos to people who've done some fabulous work negotiating some amazing contracts that have actually, for the first time in the last 2 quarters, we've started to see stabilization of vacancies in hospitals in particular. And I give a lot of kudos to the new contract for enabling that to happen, really. We are turning the corner from the pandemic. We should celebrate that. Every metric we look at in Ontario now is telling us we are doing fabulously, folks. We are attracting more people to nursing than we have seats, despite our expansion. You can look at all of Silvie's beautiful transparent data. They'll tell you we are doing historical registrations of new nurses, including international nurses, in a very timely way. Silvie is a blessing to me. I have to tell you, she's emancipated regulator. Like, I count my blessings that Silvie is in the role that she is in. She's amazing partner to me, amazing partner to all of us. She's shaking it up. And by the way, our vacancies, our systemic vacancies and our agency use is going in the right direction finally, after 3 years of the pandemic. If there's nothing to celebrate during nursing week, this change and shift in sense on nursing HHR is something we should really celebrate, folks. And our attrition rate is stable at 8%. This is Silvie's data. Have a look.
Thank you, Karima. That was great. So this next question is for both Sandra and Silvie. So we'll start with Sandra. So Sandra, what steps are academic institutions taking to prioritize the mental health and overall wellness of nursing students, especially considering the unique stressors and demands that they face as they transition to practice and during their placements and through their education programs?
Thanks so much. Excellent question. And across Ontario, academic institutions have taken major steps to continue to prioritize mental health services and wellness of nursing students. In the last 4 years, advanced mental health support and wellness within institutions even more. Mental health is and always has been a priority at the institutional level, but unique support within schools of nursing and departments of nursing is required. Learner wellness is a priority in the classroom, the lab settings, campus and personal life, and importantly, in the clinical practice setting. So universities and schools of nursing across Ontario have consistently provided mental health support and services to learners. Uptake has escalated. The pandemic escalated the change in order to match the needs of the learners who experienced isolation, uncertainty in practice, and challenges during periods of remote learning. And our collective institutions implemented major steps to prioritize wellness of our students during that period. Peer support, professional support, expert clinical instructors, technical support, and access to technology were all part of this. But the resilience and the fearlessness of our nursing students who continued to care for patients, finished their nursing programs, and who are now in practice are a special cohort of our nursing workforce. They're the pandemic graduates. So this time is now past, and we are moving forward for the most part, but practicing and learning in our healthcare settings with the demands of a rigorous educational program requires us all to continue to pivot our support and tailor wellness opportunities for nursing students. And these include, and there are many, resources such as guided self-help, peer support, student services, 24-hour phone lines, mental health crisis support, medical emergency and sexual violence support. These will remain in place and available to all our learners.
That's great. Thank you. Thank you for that, Sandra. So, the same question to you, but just a little more specifically, what innovative ideas or initiatives are you aware of that are being taken to prioritize the mental health and overall wellness of nursing?
So thank you, Jane, an incredibly important conversation for us to have, and college absolutely understands the current challenges that are being experienced by healthcare professionals. And the health and well-being of Ontario nurses is an incredible priority for us. We know that nurses prioritize caring for others and run the risk of not caring for themselves. And so, you know, we did ask ourselves, then who cares for the cares? And so one of the programs that was launched in 2019, and CNO collaborated with several organizations, including the Ontario Nurses Association, RNAO, the Registered Nurses Association Ontario, and the Registered Practical Nurses Association Ontario. And we implemented a voluntary program for Ontario nurses designed to encourage them to seek treatment for substance and/or mental health disorders that may affect their ability to practice nursing safely. And so the Nurses Health Program really embraces the philosophy that nurses experiencing these disorders should have the opportunity for education, treatment, and recovery. It also recognizes their unique needs as healthcare professionals and the importance of protecting the public. And so the Nurses Health Program is an ongoing program that offers a proven approach to assessing and treating these disorders. It's informed by research indicating that, you know, it needs to be confidential, and professional health programs are highly effective in aiding in recovery when they are so. And so we believe that with the right support, nurses can continue and return to a safe nursing practice, benefiting both the nurse and the public. And so, you know, we do see the college really prioritizing nurse mental health and that overall well-being. What the pandemic and the years since have really highlighted is just how interconnected the health community system is and how complex the challenges are affecting nurses and healthcare professionals, and can come to affect all of us. And so we know that many of our system partners have initiatives and resources in place to support nurses' mental health and overall well-being. And as a regulator, we're one part of that. And so we recognize that the challenges that nurses are facing in the profession. It's important for all of us and all of our health systems partners to work together to provide really that adequate preventative and care so that we can protect our exceptional nursing workforce. It's a very important conversation for us to have. Thank you for raising it, Jane.
Thank you. Thanks, Silvie. So the next question actually is for both Sandra and Silvie again. And Sandra, I'm going to start with you. So the question is, to address shortages in the workforce, there's been a lot of pressure to accelerate nursing education and transitions to practice, as well as nursing licensure. So as these discussions remain active, interested to know what your thoughts are on some of the critical factors that need to be considered as it relates to accelerating nursing education.
Thanks so much. Thinking about to accelerate, the most critical factor from this side is really ensuring quality BSCN education. Each institution has a responsibility to sign off on each and every learner, and for us, we have 540 graduating in a few weeks. At the completion of their nursing program, that they've satisfied the CNO competencies within the program, and they can then advance to licensure with the NCLEX, as you know, and do that with confidence and readiness to begin their career as a new nurse. So aside from the external pressures to accelerate programs related to the specific workforce crisis, our graduates really need to be ready to pursue their license and succeed. So that the narrative to accelerate and compress is upon us and is a direct result of vacancies across Canada and beyond, and thinking about how we can all do things a little bit differently at this time. But the majority of our university programs that are part of CUPN, specifically that I can speak to, already have compressed BSCN programs. And these are either second degree options or RPN to BSCN pathways. And these programs and some newly developed programs with the support and new funding continue to graduate BSCNs in a shorter time frame. And you know, this can be as short as 20 months, so 18 to 20 months. So these programs have also benefited from the support from the ministry and expansion seats. So as an active discussion, a critical factor that should be considered is what our incoming high school graduates are seeking for their educational experience. Accelerating basic nursing programs, and those are the high school students, does require summer scheduling, which is beneficial, so beneficial for our clinical partners who welcome students during these months. However, learners may not have the option to give up their summer employment to compress their education. And as such, that financial support for learners must be considered and available for accelerated programs. The new workforce also may not be willing to give up a traditional summer break from learning, prioritizing their wellness. So we must ask our future students what they value as we're making these important decisions and continue to make them. Changes to licensure will and have accelerated opportunities for our internationally trained nurses, which is fabulous. And the cross-provincial licensure will be so welcomed to add that fluidity across Canada. These are excellent and will continue to create opportunities. So I'll stop there.
Great, thanks for that. So Silvie, similarly, hoping you can share your thoughts on the critical factors that need to be considered as it relates to accelerating licensure to practice.
So thanks, Sonya. This is actually a very exciting question for us to speak of, because we've done significant work in this area, and I'm really looking at what are those constant changes within the nursing profession. And as I mentioned earlier, really seeing those collaborate with partners across the system, and that includes education and government, to really proactively address the ways that we can improve our registration processes for all registrants, including those internationally educated applicants. So one of the first things I'll speak about is how we're modernizing the applicant assessments for our internationally educated nurses. And we've done this really by enhancing the process in which to successfully increase those numbers of I'll refer them as INs, entering practice safely. So we've made changes to the language proficiency policy. Ontario has a number of ways that applicants could actually successfully compete that. We've amended our registration regulations to really increase the number of applicants registering within the temporary class. We've updated our applicant portal, where we've updated and updating our police criminal check policy. So those are just some of those pieces. And one of the critical factors around our internationally educated nursing registration is working to address really how they meet the education requirement. And so we're currently doing work in that space, and we'll be presenting some information to our council in June. And so we're proposing changes to the education requirement that, if approved by our council and the government, it will enable applicants to meet the education requirement if they complete relevant nursing education recognized and approved in the jurisdiction in which they were educated, and really looking at that as being part of that equivalency. And so with these enhancements, we really mean to accelerate the registration process, and we'll continue to register and license more internationally educated nurses than ever. So for example, I wanted to share some data in 22 and 23. We actually broke the records and we registered more than 5,000 internationally educated nurses as new nurses available in Ontario healthcare system. And this is triple actually compared to the pre-pandemic kind of our norm. And so we really believe that that is going to continue to help strengthen the healthcare system in Ontario. One of the other initiatives, and I briefly mentioned it previously, is what's referred to as SPEP, and that's a Supervised Practice Experience Partnership. And this is really what's created, with a partnership, both Ministry and Ontario Health, and really looking at supporting our internationally educated nurses to gain that practice experience. And so, in partnership, what this has allowed is, again, the ability to register more nurses quickly and safely by providing them that supervised practice experience, really under an experienced nurse mentor. And to date, more data, because we do love our data here at CNO, we've actually matched more than 4,800 applicants with over 700 employers. And that's actually enabled over 3,400 nurses to register with CNO and really provide that safe care to Ontarians. And so I'm really pleased to share that it's been just recently announced more funding for SPEP, and it'll become permanent, really helping those nurses become registered in a safe way. And so this is just another great example how we're partnering both with employers across the province to really look at what those innovative solutions are to increasing nursing resources while we maintain and are steadfast our focus on public safety. Thank you.
Thanks, Sylvie. Sandra, I'll just be the time ogre here for a second and say that we still have about 5 questions we want to get through, and we want to be mindful of people's time. So just a quick time check for us, I think, for where we are. Jane?
Okay, so thank you, Silvie. So this question is for Karima. The planned implementation of minimum nursing ratios in some Canadian provinces has stirred a lot of dialogue in Ontario. And can you just share with us your perspective on this approach and whether this is something Ontario is or should be exploring, and just, perhaps comment on the potential benefits or drawbacks you can foresee with implementing minimum nursing ratios?
And the word mandatory should be put in front of it. It's the mandatory minimum nursing ratios. And in the word mandatory are the issues that have to be really considered. So before I comment on that question, I just want to thank, honestly, Sandra and you, Silvie, for the response you provided to the last question. Without you, none of those programs could have been activated, none of them. Really, thank you. Really big thank you for your partnership. I love where both of you went, which is in the end. The answer lies in not this or that, it's in the end, which is we have to create high standard and we have to do it quickly. Because the alternative is we are speaking from both sides of our mouth, which is the sky is falling on one side of our mouth, there is a big shortage, and then on the other side saying, but we can't do this because we'll compromise the standard. No. The art of the possible is how do we maintain the standard and do it quickly? Because the alternative, I think, is less safe, less of a standard. When we completely dilute skill mixes, for example, because we don't have enough nurses to provide care, that is more of an issue than expediting a pathway for somebody who's already come in with the right qualifications into our country. So just to be careful in our profession that we don't find ourselves in the situation where on one hand we are crying about the shortages, and on the other hand, every change that we put forward that can put thousands of nurses in the system, that we resist those approaches. So big thank you to both of you, really. On the question of mandatory minimum ratios, first of all, I'm a big believer of safe staffing. That goes without saying. We have to staff our units safely to provide care to people. And as you know, all of us are nurse leaders. The way we do it, we consider the acuity of the unit, the environment, the composition of the interdisciplinary team. Many things are considered to determine safe staffing levels for a given unit, a clinical service. I'm all for it. Who would argue against safe staffing levels? However, that's different than mandatory minimum ratios. Mandatory minimum ratios, if you follow the evidence, and Linda Aiken's work, for example, yes, of course, there is evidence to support minimum staffing ratios in areas like critical care, where there is such high acuity and complexity. There has to be a certain kind of minimum mandatory staffing ratio to care for that complex environment, complex situation that we encounter for nursing. The other area is those areas that have desperately need a focus on safe staffing, like long-term care. Having established this idea of there be 4 hours of direct patient care, just to draw attention to the level of staffing we have to build in those environments, I'm all for discussing a minimum staffing level like that. But if we do that across the board, I think we have to consider a few things. First of all, to talk about minimum mandatory staffing ratios, when there isn't an evidence to support what kind of a ratio needs to be in place for what kind of patient population and unit, it's a bit irresponsible, is what I would say, and particularly in a shortage. When you have a shortage of staff of every kind, in the system, which is the situation we find ourselves in, unfortunately, because we have 15 years of non-action in the system. It's almost irresponsible to say, you know, a med-surg unit, I'll give you an example, for example, needs a 4-to-1 staffing level on a day shift, when you know there aren't enough nurses to fulfill that staffing ratio. So I just worry when you don't consider a holistic approach to determining the staffing complement for that unit, and you're simply running behind a ratio. One, you won't be able to fulfill that ratio, most likely because we have a shortage. Secondly, because it's now a number that has to be filled, you'll fill it with other kinds of people. So you'll have this inadvertent migration toward skill mixes that will be actually worrisome for patients. And you will not consider all the nuances that have to be considered. So it'll be kind of a more, the intent is good because the intent is safe staffing, but doing a mandatory minimum disregards all the other considerations that we have to put into place. So I worry like that. I'm more of a fan, honestly, of in some areas, it makes sense to do minimum ratios, but in most of our care areas, it has to be a careful consideration of a variety of factors. And the 3-factor framework, the 4-factor framework for safe staffing, I'm more inclined towards those. And in a place where we are in a shortage situation, it's the more responsible thing to do. It's just like, you know, when you say you will screen a patient for A, B, and C, and if you don't have interventions available for what you have screened for, that's a sin. That's irresponsible. So that's what I worry about. But the intent is a good intent. You want to staff area safely.
Thanks, Karima.
Thank you. So Silvie and Sandra, I seem to be picking on you today. Oops, yeah. So Silvie, I'm going to start with you this time. Can you tell us a little bit about initiatives or strategies that you know of that have been implemented or planned to promote equity, inclusion, and diversity within the nursing workforce? And, you know, how do we go about measuring their effectiveness in creating a more representative and supportive environment for all nurses?
That's a great question, Sonya. As a regulator, we absolutely value innovation, integrity, collaboration, and well-being, and, you know, underscore our commitment. We're wanting to create a culture that is diverse, equitable, and inclusive. And so we've made an organizational commitment to really embrace DEI principles in our work, along with our lived experience of our staff, our nurses, and our system partners, and the public's experience of nursing care in Ontario. And so we have recently hired a director of DEI whose sole role is really DEI. And so recently, you know, we've launched our workforce census. And so we wanted to look at really support a 3-year enterprise-wide strategy that is being rolled out. And in the hiring of the director now, we're doing all the work and launched our first census in February of this year. And so we know that individuals have historically marginalized groups experience racism, discrimination, and systemic barriers in their personal and professional lives. And the nursing profession is no different. And so we're currently analyzing the results, which will provide an important snapshot of the demographic composition of Ontario's nurses. And we're really proud that over 31,000 nurses participated in the survey, and that represents over 15%, is 15.5% of our membership. And so the results will really enable CNO to give Ontario's health system the data it needs to address diversity, equity, and inclusion, and really the issues that nurses face. And it will give us the baseline really to identify what are those gaps and measuring progress, ensuring that we advance policy that are more equitable and inclusive. The other thing we've done at CNO very intentionally is look at our code of conduct, and it's another action we've taken to ensure we are more diverse, equitable, inclusive in ways we've updated the code of conduct, which is our overarching practice standard. And so we have revised the code that came into effect June of last year and really reflects the dynamic nature of the healthcare environment and features a new principle focused on diversity, equity, and inclusion. This is an important conversation for us at CNO. So thank you for that question.
Great, thank you. Sandra, over to you, same question.
Well, similar to Silvie, across Ontario, So many initiatives and strategies have been implemented in academic institutions. And as an example, at McMaster alone, similar to all of the other schools and universities, EDI strategy exists at the central level, at the faculty level, and within our departments and schools. And investments in across university settings are embedded in policy and processes, which espouse institutional commitment and capacity. And that's via leadership, governance, and accountability, as well as academic content and context. And that covers research, teaching and learning, and then diversity and community, where student access, student success, employment equity, and community engagement are all addressed. And measurement of effectiveness through research, performance indicators, and climate surveys assist us to guide continuous growth. Academic institutions preparing the new nursing workforce must all have a vision, values, and a purpose for this. Strategies extend from the moment a student applies to a program to graduation, where our learners have access to safe spaces, peer support, and more. But the established EDI policy within a supportive environment education is key to support the transition of our nursing students into the workforce. Not all environments have progressed at the same speed with initiatives and strategy. And we know our nursing students have voiced their concerns about their experiences in practice, and too many of these are anonymous. So schools of nursing all have a commitment to respond as well to Truth and Reconciliation, the Truth and Reconciliation Commission of Canada's calls to action. We are addressed directly, and this work is ongoing, and we have so much more work to do. But effectiveness of our response to TRC can be seen with more Indigenous nursing applicants, more enrolled, more successful graduates, more First Nations, Inuit, and Métis faculty, and much more knowledge on the ways structural racism exists in policy and health systems. So Indigenous nurses bring unique knowledge about health and understanding, and all of our education is ongoing. So thank you.
Great, thank you, Sandra. So this next question is for Karima. So Karima, there's a high percentage, as you know, of novice nurses in the workforce, and we're now seeing a significant range of skill mix in nursing teams, senior to more junior nurses that are impacting their dynamics and effectiveness. So what strategies do you suggest to address and meet the needs of the nursing workforce as a whole?
I think it's the most crucial issue, actually. The level of new practitioners, not only in the system as a whole, but in areas where we were not used to seeing the introduction of new practitioners. In ICU, in my time, when I was nursing at the bedside, you had to have 5 years of solid med-surg experience before you could become a critical care nurse. I went through that. So now it's, my God, new nurses are everywhere. And I'm going to choose to see it as an opportunity because they're bringing the new eyes and new ways of seeing things, and they will push us in our thinking significantly. And we've put a skill mix, by the way, in some of these complex areas that we had never seen before. I just took my mom through an experience through Emerge in one of our academic hospitals. There were a number of PSWs in Emerge. I'd never seen that in my life before. And I cannot tell you how thankful I was that they were there, because otherwise she would not have had the assistance she needed to bathe, ambulate, go to the bathroom, because the nurses were so busy dealing with the complex clinical work that they were doing. So anyways, it's, what shall I say, for a growing population and an aging population where we will see more and more use of our healthcare system and demand on the healthcare system, this is the way of the future, and we better just come to terms with it. Is the way, it is the reality. We've come to our reality predictably, considering the growth of the population and so on, and the demographic shift. So it's here to stay. It's here. It will continue to grow. So let's embrace it. Let's ensure those individuals feel comfortable. You know, the biggest turnover we have is in the first 18 to 24 months. That's when nurses turn over. That's the biggest retention opportunity we have towards our novice, new nurses. So the answer to the game is bedside mentoring. Bedside mentoring, not the educator who floats in and out of the unit or takes you into a classroom. No, it's that clinical scholar, nurse, who comes to the unit 24/7 to provide support to you at the care site. I've had that, by the way. I came into the system when we didn't have a shortage, but it was at Sinai, Jane, your place, and it was on 17 South, which at that time was a med-surg unit, and Kathy Kitely was my clinical mentor. She held my hand through every new experience I went through on that unit, and it took only 2 weeks. 2 weeks of exposure with hand-holding with that individual. I was golden. I was ready to fly. It's that level of, you know, just initially give the comfort interventions that are needed from a mentoring perspective, but make sure it's at the bedside and it is 24/7, because nursing is 24/7. It can't be a 9 to 5 opportunity only. And it has to be very non-judgmental. We think we may be creating practice-ready nurses, but sorry, they have not been exposed to every clinical scenario that they might encounter in a clinical area. It's unrealistic to expect every clinical scenario has been encountered. I'm a graduate of MAC, Sandra's shop. I wasn't exposed to all the skills that I saw in my first week of practice. I needed hand-holding. So that's what's needed, I think, in the front end. And towards our expert nurses, I think if we want to keep them for 1 year more, 2 year more, 3 year more, we have to think about alternate work, because they may be tired. The reason they are leaving is they can't do what they are doing anymore. So can we give them a different opportunity? Can we free them up for some days of direct patient care work so they can be in the mentoring role towards these new nurses? And I've seen examples of this in my 1.5 years of this role. They are wonderful examples of it, alive and well in many, many places of work. So it's a matter of scaling them and replicating them. The new practices are upon us, and people are rising to that challenge. It's nothing new that we have to do. We have to just learn basically from each other. And the last thing I'll say on it is embrace the skill mix. Don't be afraid of the skill mix. It's okay. It's okay for a PSW to take on the role of changing a patient's, you know, or ambulating them or feeding, assisting with feeding. It's okay. Let's rise to the true potential of what we have to do now in the new healthcare system. It's okay to give things up. And its change is very fearful, but there is an opportunity in this change that we can rise to.
Thanks, Karima. Silvie, I'm going to you with this question. So Silvie, can you tell us how you see the role of nursing evolving in Ontario's healthcare system, and in particular in response to the changing demographics and healthcare needs?
Yeah, it's a great question. We're actually very excited about this work and proud that we can say we're the largest group of providers in Canada, and we've got a proud 60-year history of really influencing that agenda in a way that will continue to support healthcare system and promote safe nursing practice. So we do believe that when we're training and the expertise of nurses is used more efficiently, healthcare is actually more accessible to patients, and some pressures on healthcare system can be alleviated. So what have we done? So the first standards of nursing practice for registered nurses and nursing assistants was actually approved in 1976. And so we were the first regulator in Canada to establish that written minimum standards for our members. And so in response to the changing healthcare system needs in Ontario, there's been many scope of practice evolution since then. And so we do support the Ontario government in making changes to expand nursing scope of practice for really all those categories of nurses, ensure that they're accountable to practice within their legislative scope and also within the standards that CNO sets. And so we're going to continue to have dialogues with the ministry and really explore those scope expansions. One of the things that we've just recently done is RN prescribing, and recently we'll be also doing some scope changes for the MPs. And so when we looked at our current regulations, we actually under the new regulations were approved in November 2023. It authorizes RNs in the general class who meet specific requirements to prescribe certain medications. And also that includes communicating diagnoses for the purpose of prescribing those medications. And so we're proud to say that this represents an incredible leap forward in nursing practice, really empowering RNs with the knowledge, skill, and judgment to assess, diagnose, and treat defined non-complex conditions. Additionally, in the same time period, November 2023, changes were made and exemptions under the Controlled Drugs and Substances Act, and that really allows NPs to prescribe anabolic steroids for therapeutic use. And so I'm saying these scope changes really mean that Ontario nurses can provide more direct care to support patient safety and really better connect patients with the care when they need it the most. Thank you.
So
Go ahead. I think we're going to end our questions at this point and conclude the event. And I just wanted to share a big thank you to our wonderful 3 panelists, Karima, Silvie, and Sandra. You are truly a dynamic trio and have provided such important insights. And, the future of nursing is bright, but particularly with the 3 of you at the helm at this inflection point in nursing, I don't think we could be in better hands than with the 3 of you as as leaders. I want to thank our attendees as well for your questions and for attending our 2nd annual TAHSN Nursing Week event. We'd love to hear your feedback about this event and invite you to please take a minute to just complete a short survey that we've created. It'll be shared in the Zoom chat. And just a reminder also that the recording of this event will be available publicly on the TAHSN website by Tuesday, May 14th. And so thank you, everyone, for joining us today. And I really hope you have a great rest of the day and enjoy the upcoming weekend and Mother's Day weekend. So thank you all.